Hello, welcome. Thank you for joining me. I'm Dr. Brittany Panico. You can find me at AZ Room Doc on Instagram and right here on Facebook as well. Thank you for joining me if you're a new follower. You can also find me on LinkedIn, Dr. Brittany Panico. And my Doximity profile also says a little bit about where I am professionally. So check me out if you're looking for a rheumatologist. Today, I'd like to talk about something that is in the news quite a bit recently. And living here in Arizona, in particular, there's a very hot topic circulating about the use of methotrexate, particularly for females of childbearing age. Methotrexate is a medication that is part of the foundation of treatments that we use in rheumatology. Anywhere from inflammatory arthritis, like rheumatoid arthritis, psoriatic arthritis. There's a recent indication to use with a medication that we use to treat for gout. And it's also used for things like myositis and dermatomyositis and lots of other reasons. So if you're on methotrexate or have ever had a conversation with your doctor about methotrexate, then hopefully you're aware of the reason that it's being prescribed for you. But right now, there's a lot of talk about difficulty getting your medication filled through your pharmacy, particularly for females. And the reason that is because methotrexate is used for therapeutic abortions. And with the overturning of Roe versus Wade, depending on the laws in your state, it can be a little bit challenging to get methotrexate if you're taking it for other reasons. And to have that conversation with your pharmacist is important if there's any discrepancy with your medication. And then also have the conversation with your doctor. And one thing that's helpful is to make sure that your medication is attached to a diagnosis. So when a doctor or healthcare provider prescribes a medication, we have the option to mark why it's being prescribed. This is called an indication. So methotrexate is prescribed by a rheumatologist for different types of autoimmune syndromes. And we can attach that diagnosis to your prescription. So that way your medication says take for your diagnosis. Or it's attached on the back end when the pharmacy applies for coverage by your insurance. So it's helpful in multiple different ways to know why the medication is being prescribed. Also, methotrexate, the way that rheumatologists prescribe it, is on a weekly basis, meaning you take a certain amount of pills, anywhere from 4 to possibly 8 pills every week, the same day each week. And you also are prescribed folic acid along with that. So the pharmacists know to look for that indication for your diagnosis, the timing of your medication, meaning how often you're going to take it, and then also, are you being prescribed folic acid along with it? Methotrexate can also be dispensed in a vial, so you can pick up a liquid from your pharmacy, and that's used with something like an insulin needle or very small needle and syringe, or it can be prescribed as a pre-filled pen syringe through 2 drug manufacturers, and those come through specialty pharmacy. So that's a little bit of a different topic. But I just want to bring to your attention that if you're having any difficulty filling your medication, that foundations like the Arthritis Foundation are being very vocal about the ability for people to have access to their medications, especially in a timely manner, given the change of the political climate that we're in. So if you're having any difficulty, contact your rheumatologist, and you can look on the Arthritis Foundation website. I can provide a link to help navigate where to look. And they're giving information out about ways that we can help advocate to keep methotrexate being dispensed regularly to our patients. There's no shortage of medication. So during COVID, some of you may remember that hydroxychloroquine was essentially very, very restricted because it was approved as an early treatment for COVID-19. So a lot of patients, particularly our lupus patients, had difficulty filling their prescription because there was essentially a national shortage of the medication. Methotrexate is not in short supply. It's just being more regulated because of the political views and the changing laws. So therefore, it can be a little bit trickier to access, but there's the option to get your medication through mail order pharmacy. There's always the option to switch pharmacies and essentially shop around to see where you can find the medication in town. And then also just be honest with your pharmacist and let them know, I'm taking it for this purpose, for my arthritis or autoimmune condition. And that is something that's easy to be cleared up. So I encourage you, if you're on methotrexate or even contemplating starting methotrexate, to just be aware that there's a little bit of controversy about dispensing methotrexate to young females. That does not make it wrong. It does not make it a bad treatment or a poor choice of treatment. People can take methotrexate no matter essentially whether or not you're a young female or a male. It just depends on the reason that you're using it. And I'd like to also bring that up because a lot of patients that we discuss methotrexate with then come back to their next visit after not having filled the prescription because they went home and Googled it and chemotherapy came up as part of the reason that methotrexate is used. And yes, that's true. I do try to warn my patients that there's lots of information out there online about methotrexate, even more so now, right? But the reason that methotrexate is used in rheumatology is because it actually helps prevent the spread or prolonged effects of your immune system causing damage, particularly to the joints and muscles. So we are not prescribing it as chemotherapy. We're not knocking away your immune system by using it, but we're helping decrease the inflammation signals that trigger damage caused by your immune system and prolonged inflammation. And there's been studies in the cardiology world about using methotrexate to help decrease damage after heart attacks. So lots of specialties have an interest in methotrexate, not just rheumatology, hematology, and OBGYN. So I really encourage you to be on top of your prescription refills just in case there's an issue at your pharmacy. And if there is an issue, contact your doctor's office because we can help. We can help you navigate how to get your medication and continue to take it as prescribed to decrease your flares, to improve the way that you feel, and ultimately to help you live your best life. So with that being said, I hope you found this helpful. And if there's any topics or suggestions for topics, shoot me a comment. I'd be willing to talk about most things. I do not provide direct medical advice unless you see me behind, in my office, but I don't provide it publicly. So those topics are off limit, but I'm willing to talk about, questions, medication topics, explain disease states a little bit better. I'm going to try to get into a little more of what certain conditions are, especially those that are harder to find online. And ultimately, I just want to provide a resource for patients to come and watch a video for, when you're between office visits and have questions about topics that you maybe forgot to talk about with your doctor or healthcare provider. So I'm really glad that you're joining me. I hope you keep coming back and are interested in these videos and topics. And again, you can find me in Phoenix, Arizona. All right, thank you so much.